Good afternoon, everyone, and welcome to our Primetime Alive program today on COVID-19. I'm Vicki Newell with the Primetime Alive program here at Mary Greeley. This is our second virtual program, and I hope it goes off without a hitch, just like our last one. But please, if you have any suggestions after the program on how we could make this a better experience for all of you, please go ahead and email me. I'd love to hear your ideas. Another couple notes that I would like to make sure that you're aware of. Yes, we are wearing masks here at Mary Greeley Medical Center, but when we're in a private space where we can maintain physical distance, we do not have to wear them. And right now I'm in a 150-seat auditorium, and it's myself and two presenters. So we will keep our distance and we'll make sure everyone stays safe. Also, just want to let you know, you will not be able to unmute your microphones to ask a question. Every question you'll have to type in. And so what you'll need to do, up in the upper right-hand corner of your screen, if this is not open, this pop-out isn't open for you to ask a question, you just have to hit this arrow up here to do that. You'll get something that looks similar to this. At the bottom, there's an enter a question for the staff. If you just type your question in there and hit send, it will get added to the queue, and then at the end of the presentation, we'll get to as many of those as possible. So we have two presenters today, and I'm going to introduce them both right now, and they'll take turns here. Our first speaker is Amber Deardorff. Amber is the Vice President of Clinical and Support Services at Mary Greeley Medical Center. She has a bachelor degree in exercise science from Iowa State University and a bachelor degree in nursing from Grandview University. She went on to achieve a master's degree in public administration from Drake University. She's worked at Mary Greeley Medical Center for 18 years in many different areas, including Director of Clinical Applications, ICCU bedside nursing, and as a clinical coordinator in the quality department. She's currently the executive leader of a whole lot of areas, including laboratory services, radiology services, cardiopulmonary services, rehab and wellness, surgical services, human resources, education management, chaplaincy, and facilities management. And she is currently the incident commander for our COVID-19 emergency management planning and loves working closely with partner organizations, staff, and physicians. Our second presenter will be LeAnn Hillier. LeAnn has been with Mary Greeley for 14 years. With 10 of those years as the infection prevention coordinator and 4 years in the nursing support team role. Prior to Mary Greeley, LeAnn worked as a nurse in the surgical trauma intensive care unit at the University of Virginia. She received her nursing degree from the University of Virginia and her master's in public health from the University of Minnesota. Now on to our program, and please welcome Amber Deardorff.
Hey, good afternoon, everyone. I am very happy to be here and to talk through everything that Mary Greeley has done really since early January. And so the first part of this presentation will be all about that, just what we as an organization have done as a result of COVID-19. And then I am going to hand it over to LeAnn, and she's probably the one you really want to hear from. It's how you yourself can stay safe during all this, and then just more answers to COVID-19 questions that you probably have. Before I start, I love this quote: "View life as a continuous learning experience." And that's truly what COVID-19 has been. Who would have thought? I always say that we started back in January. Someone called and said, "Hey, Amber, what would you think if we started what we call an incident command about this coronavirus that's happening over in China?" And I said, "Okay, sure." Little did I know that this would have been, what now, a 6-month journey to where we are now. It's been a learning experience, and truly things are changing every single day. So just a little bit about the disease before we start. COVID-19 is the name of the disease. It's the disease. So the CO is for Coronavirus Disease 2019. You've probably also seen SARS-CoV-2. That's the actual name of the virus. And so SARS-CoV is the name of the virus that causes SARS, that sudden acute respiratory syndrome that we're seeing with many of these patients. And so coronaviruses have been around forever, and we probably have them in our community each and every day. And it's a family of viruses that really are a set of cold-like symptoms. However, there have been 3 severe illnesses caused by a coronavirus. Those have been SARS, MERS, and now COVID-19. So SARS-CoV-2 is just thought to be originated from bats based on some of the studies that have recently been done. So as we continue forward with COVID-19, back in March, it was kind of yet to be determined on how serious this disease would really impact the US and globally. And these numbers paint a very vivid picture. So SARS, back in 2002, a little over 8,000 cases globally, 774 deaths resulted from that SARS-CoV. That was a little over 9.5%. MERS came along in 2012, so less infected people, so about 2,500 cases. However, 34% of those cases did result in a death. So now we have COVID-19. There's been over 5 million, now it's over 6 million cases globally, and over 325,000 deaths associated with that. And right now the numbers are about 6.5% of these patients that contract COVID-19 die from the virus. And so these numbers were accurate as of Wednesday. So we had to get this presentation out to Vicki and her team on Wednesday. So these have already increased, but as of Wednesday, every country in the world has had a confirmed case. Like I said, over 6.3 million cases. This one says 377,000 global deaths. And you might be wondering, so what's happening? Have we seen the peak and is it starting to decline here? And so what this is showing is a few countries, so the 10 most affected countries, and they're all, and these were European and the US. And you can see all of them are starting to see a decline. If you look globally at the numbers right now, South America, Middle East, India are still seeing a little bit of a surge going on, so we'll certainly want to continue to watch those countries. But here in the US, we have leveled out. I don't know if I would be comfortable enough to say we're on a big decline or not, but we're not seeing the big surge, especially here in Iowa, that we and many others were seeing earlier on this year. And so here in the US, we have seen over 1.8 million cases, 105,000 deaths. And once again, it's in every state here in the United States. The Iowa Department of Public Health has a really fantastic site that will keep you updated as it goes for the state of Iowa cases and COVID-19. I certainly encourage you to get onto that site. It's, once again, Iowa Department of Public Health. And once again, these are the numbers from Wednesday. You can see that as a state, we have tested over 164,000 individuals for COVID-19. Of those 164,000, a little over 20,000 have come back positive, or about a 12% positive rate. One thing that I would like you to kind of pay attention to here is underneath that individuals positive, there's that graph there. So you can see there was a pretty large spike in mid to late April, and it appears that that bell-shaped curve is starting to appear here. So we are leveling out as a state. There's fewer confirmed cases coming in each day, but we still are seeing pockets of outbreaks. So we certainly can't stop what we're doing to prevent this virus from spreading, because it certainly could pick back up. This is also from the Iowa Department of Public Health website, and it outlines which cases are seeing the most COVID-19 cases. Here in Story County, you can see 118 there on the slide. Per our Story County Public Health Department this morning, they actually indicate that we have 115. So what happens with the state of Iowa, sometimes we get associated with a certain patient, and then once they do some of the back tracing, they find that, oh, it was actually a Marshalltown or a Marshall County patient or a Boone County patient. So right now, per our Story County Public Health, it is at 115 confirmed cases here in Story County. And then we have a 13-county region that Mary Greeley Medical Center serves. And so we also keep a close eye on those counties. So it goes far west as Carroll. It's also Sac County, over all the way to Grundy County, and then Tama, Marshall, Story, Boone are also in our 13-county region. So that means any of these patients with COVID-19, they are probably going to be referred here to Mary Greeley Medical Center. So we like to keep a close eye on those patients as well. And then you might be asking, well, what about Mary Greeley? What have you seen? We saw our first confirmed patient back in March. So March 22nd, 2020 was our first confirmed case here at Mary Greeley. We have seen a total of 49 total patients now. 17 of those 49 patients have been admitted to the intensive care unit at one point during their stay. 12 of them were intubated by a ventilator at one point during the stay. We have had 2 deaths here at Mary Greeley. One of those deaths was on the patient was well enough and recovered enough to be extubated, and she was able to make her own choice on whether she would want to be re-intubated or not. But we have had 2 deaths, and those are always devastating to the community and to our staff that work with these patients each and every day. And then we're actually down to 5 patients that are currently admitted. So we had 1 discharge today. And then we also had 2 confirmed COVID patients that we were able to transfer from our COVID unit up to a medical unit because they have tested negative for the virus now, ×2. So they are fully recovered and now out on the medical unit. So that's a success as well. So as I indicated earlier on, we started this actually way back in January. The hospital systems, state of Iowa, we have emergency management groups called incident command teams. So here at the hospital, we started our incident command team early January. And within that incident command team, we pulled in experts around the organization. So that included infection prevention, our supply chain, nursing, those ancillary services, and we started planning. Honestly, back in January, I don't think any of us could have predicted what came our way in March and April. But we started at that time ordering our PPE supplies, or that personal protective equipment. So we started bringing in additional masks and isolation gowns, preparing for what may come later on. We saw our first suspected patient back in February. So February 9th, it was a patient that had just traveled from China, had all the symptoms, came through our emergency department at that time, but was well enough to quarantine in their own residence. And then March is really when we started picking up speed. So we transitioned to daily incident command teams at that time. So this group, that's really all we did for the month of March and April. I would say that's all I did for 12, 14, 16 hours a day, 7 days a week, in order to prepare all of us for what was coming. We also had a number of employee, provider, leader, and community town hall sessions to make sure that everyone here in the organization understood what changes were being made and how we were going about protecting our employees. So to date, we have had 9 total employee town hall sessions. And originally, our very first one was done here in Bessie Myers Auditorium. We were all sitting right next to each other. No one had masks on. That was a different time back in March. That was before we had our first confirmed case even here in Story County. Now all of these town hall sessions are done via electronic WebEx type scenario, similar to what we're doing right now. On March 12th, we did that non-essential travel ban. So that was still prior to spring break, and we just told our employees, hey, no more travel for work, we're gonna stay put. As we continue to walk through this process, we had to get stricter and stricter with people coming into our organization. We had to start screening everyone walking into our organization. Back on March 20th, we decided to cancel or postpone all of our elective cases. So any surgeries or procedures that were being done in the organization were canceled between March 20th and late April. So that was a long period of time for all of those departments to be just completely without staff or patients. We also understood the importance of making sure our employees had mental health programming. So this was, as you can imagine, very anxiety-provoking for the majority of our staff. It's a scary time. A lot was unknown about this disease. And so in mid-March, we started offering different types of mental health programming for all of our employees and providers. One thing we've done, and I've mentioned it here, March 24th, it's PPE rounders. And that is something that no one told us to do it. It was just a need we saw, and I will say it's now a best practice throughout the nation. But it's really the idea of finding one or two individuals that fully understand how to put on all your isolation gears, how to take off all of the isolation gear, and we put them in front of those COVID positive rooms. And so those individuals really were there to help educate the staff and providers, making sure that everyone remains safe here at the organization and caring for these patients. We also knew that if you watched what was happening out in New York, you might have seen that their volumes got so high, those hospitals had to start making decision of which patients get a ventilator and which ones do not. God forbid, we never wanted to get into that situation. Luckily, we never had to. But we engaged our ethics committee then in early April to help us formulate some policies and procedures around that. What happens if we run out of PPE? What happens if we run out of ventilators? What happens? You know, all the different scenarios. And they were engaged to help us with those decisions. Testing has also been a big thing. I certainly saw the news and articles from China, from Europe, and I didn't understand it until it hit here at Mary Greeley. Testing and the inability to test every single one of our employees and patients that walk in the door when we need to has been a barrier. And so right now we can and do have the ability to test our patients here on site in about an hour turnaround time. However, our capacity for those testings is very, very limited. So each and every week, we are supposed to get between 120 and 180 tests to help with anyone coming into our doors. We've had this ability since, as you can see there, April 27th, so it was a long ways into our journey before we were able to test here on site. And of those 6 weeks that we've had that ability, we've had 2.5 that just no test kits came whatsoever. So we were kind of back to ground zero where we had to reach out to reference labs to help us with the testing, which is great. It's just those turnaround times are anywhere from 2 to 7 days. There was even one point in the process where turnaround time was up to 14 days. And so that just blows through all of the PPE and really makes us think differently in the care for these patients. And then the governor on Friday, I believe it was the 26th of April, I think that was that Friday, the mandate that she had for elective surgeries went through May 1st. So we had all of our plans, we were making plans. Well, that Friday, she said, well, you can start doing them now. And so we had to quickly kind of revert what we were thinking and come up with very quick plans to safely resume elective procedures here at the medical center. So it was Tuesday, April 28th, that we were actually able to make this happen. And we started slow. So because we didn't have the ability to test every single patient coming in, we are testing those high-risk ones, and we're assuming those that we are not testing, we're assuming that they're positive. And so that means that everyone wears all the PPE, and that means it's a much slower process to get everyone safely through their surgical procedures. And so we started out at about a 50% capacity way back on April 28th. Since that time, it's kind of become our new normal. We're starting to understand how to care for these patients. We have had 0 employees testing positive for COVID-19 from a work exposure. We have had 3 employees that have become positive from a community or family exposure, but we have done a great job as an organization. Our staff are incredible at utilizing the correct PPE, staying safe, and infection prevention. LeAnn, who you're going to hear from here next, just was instrumental in all that as well. So kudos to her, her team, and all the staff for making this so possible. On May 21st, I do want to point this out. So you probably, hopefully saw this on KCCI, but we had in mid-May a period of time where we had a little surge. So our ICCU was full. We had several ventilated patients at that time. And it was a little dicey and a little scary at that time. And so starting on May 21st, we started to see the success of many of these patients being extubated, so not being ventilated anymore. And our providers, so that's who you're seeing in that picture there, they called and said, you know, we really need something to lift our spirits. What would you think about playing Here Comes the Sun from the Beatles overhead for all to hear at Mary Greeley once we extubate a patient? And we made it happen. And I can say, walking around the hospital halls, when this played overhead, people started crying, you saw people jumping, lots and lots of laughter. But this was a big thing and something our organization needed at that time. So we still, anytime a COVID-19 patient is extubated, we will play Here Comes the Sun. I am so not going to go through everything, and I don't expect you to read what is on this slide. I just want to show you all the work that has been done around surge planning. And so back in January, when we started this process, we really didn't know what to expect, and we started the planning at that time, and we started it in a phased approach. And so this group of experts, we came together, and we created surge planning around staffing, bed management, our surgical or elective procedures, and then the visitation policies for visitors coming in. And luckily, we never got past phase 2. We have been in phase 2 for quite some time, but we have never had to initiate phase 3, 4, or 5 surge plans, and that's great. Once again, I won't go through all this. If you have specific questions, I'm happy to have a conversation with you offline with it. But this is how we went about planning for any surge that comes through our Mary Greeley walls. And I know a question I've been asked quite a bit, because it's in the media all around, is ventilator management. And that relates to our surge planning as well. But how many ventilators does Mary Greeley have, and are we ready for this type of a surge? And so, yes, we have so many different options for airway management of these COVID-19 patients. What I'm showing you here on the screen is truly our ventilators. But even outside of this, we have many, many options for helping patients through this before they would even get to a ventilator. But we have what we call our critical care vents. It's what we would use in the intensive care unit. We have 6 here on site that we currently have. We have never gone over 5. We have 6 of our own. We did go over 5 in that mid-May time. So we actually reached out to our region. And a region is what the state has done to help cohort some of the supplies and needs based on who is surging. So we reached out to our Methodist partners down in Des Moines and said, hey, we need more ventilators. Can you help us out? Methodist said, oh, absolutely, yes. Please keep the patients there, because they're also surging, but they had extra vents. So we brought 3 vents from Methodist, and then our ISU Vet Med partners also had one, the exact same type brand that we have here, and so we had that one available to us as well. Next in line, if we go through all the critical care vents and if everyone else around us did not have extra to send us, we have lots of different options too. So we have transportation vents. So it's what we have on our ambulances. It's what we use in the hospital to transport from like ICU down to radiology. We have 5 of those. They function as normal vents. We could do that. And then finally, our anesthesia department. Obviously, we use these often in our OR cases. We had 18 of those that we could pull on. So truly, we had enough ventilators to care for the patients. If we would ever surge past this point, we would need more help because we would be out of beds and space here at Mary Greeley. So we certainly are well taken care of as a community. And then the second most frequent question I get is about our PPE supplies. This will be an ongoing issue, and is certainly something we watch each and every day. In a typical year, the supply chain for healthcare in the United States, about 300 to 500 supplies go on a watch list or a shortage disruption list. This year already, and this was about 3 weeks ago, but 10,500 different supplies are on a protected allocation. There are several things that we just can no longer get. And so we're being flexible. We're being open to other options here at the organization. Right now on our watch list, it's really the disinfection wipes and cleaners. The normal vendor that we use, they're just not supplying anymore, and they don't think they would be able to get any more to us until fall. Luckily, we have many, many, many different options. So we're safe, we're doing everything we need to do, it's a different product, and it's just retraining then for our staff. It's all about masks on the news, and so yeah, N95 and procedural masks, it's always on our watch list because the supply is disrupted, but we're okay right now. We actually have the ability to clean our N95 masks. We are doing that right now. We're not having to reuse our N95s yet. So we're cleaning them, we're storing them, and then God forbid if we ever run out of the new N95 masks, we would be able to pull from that supply that has been disinfected through our disinfection process. Isolation gowns right now is kind of the big item. We have disposable isolation gowns. They're dwindling fast and we're not able to get more here on site. So once again, similar to the disinfection wipes, there's other options that we have. It's just going to be different. So it's going to be a different way to put them on. It's going to feel different. So it's additional education for our staff. We're also bringing in some reusable gowns in certain areas. And then everything else needed to care for these COVID-19 patients are really disrupted at this point. So IV tubing, feeding pumps, I mean, you name it, it's disrupted at this point. And then testing. I'm hoping I just covered your three main questions of surge, PPE, and now testing. And I alluded to it before, but right now we have that in-house testing. And right now, per month, the maximum we would get is 180 per week. We're not getting that yet. We also have a reference lab down in Ankeny that has helped us through this time, and we can send them up to 25, maybe 30 tests per day, and they're the ones helping us with our pre-surgical, pre-procedure screening. That's about a 24-hour turnaround, though, and so it's great, but it's useful for certain types of cases. So eventually, we would love to be able to test any single patient that walks into our door, but it's a math problem at this point. And so as you see below, right now, so in our current volumes, we have decreased volumes right now. We would need about 2,000 tests to be able to test every single patient that walks into our door. Well, you can see from above, we're not there. And then as we continue to open things up, as our community comes back into the hospital and into the clinics, eventually we're going to need 2,500 to 3,000 tests per month in order to test every single patient that walks through the door. We're a long way from that. So we continue to meet with our vendors, meet with area reference labs, but this is really going back to the state too. We as a state need to figure out how to get testing available to all those that need it. And then this is my chance to say thank you to the community, and I'm sure several of you on this go-to meeting have helped in this as well. But the acts of kindness that we have seen, I'm not an emotional person, I'm really not, but the notes that we've received walking into work at 5 a.m. day after day and seeing these awesome sidewalk messages from our community has been everything. It's got us all through this time period. We've also had area organizations, people donate food for our staff, and that continues even today. And thank you. I mean, that, like I said, that's everything for our staff. As it goes for personal protective equipment, we couldn't have done this without the help of our sewers. Like this says, over 6,000 masks have already been donated to Mary Greeley Medical Center. That's all of our non-clinical staff have these masks, and then certainly every patient and every visitor that walks in our door is in need of one of these masks. So thank you for keeping us safe. And then the foundation has also received several donations to help in this. So we have staff support, patient support, funds to help us with this additional PPE cost, and then technology. Like Vicki said, we can't meet in person anymore, so our ability and our need to get technology out into the homes, so for our staff working from home, and then the ability to do all of our meetings and group chats via electronic means was a very quick and fast change, and we couldn't have done it without that support. All right, now I'm going to hand it over to LeAnn.
Hello, so I'm going to go ahead and remove my mask. Good afternoon. Thanks for having me. Amber, thank you very much. Did a great overview. I'm going to dig into a little bit more about how to actually protect yourself. Get this. So kind of like what Amber said, I just want to put this out there, a disclaimer. Things are constantly changing, and yes, we do not know everything. We do not have all the answers. The name of the game for us really has been flexibility. We've made lots of changes continuously, and the staff have been incredibly flexible, so that's been just a great thing to see. And then I do want to point out that the guidelines and resources for you, same ones that we use as well, are listed there. CDC, World Health Organization, and the Iowa Department of Public Health are wonderful resources for all of us. Then I am going to play just a quick little video for you here. Okay, so that video really provides a great visual representation of how particles spread. It's icky, but I think that calming music somehow just makes it all better. I don't know. But what I really want to emphasize, and with that video shows, is what the schematic here on this diagram shows is the large droplets versus the airborne. The large droplets that you hear about in the news and from the health department, the whole 3 to 6 feet, that came from a 1930s study of influenza. Okay, a lot more recent data has come out. MIT researchers have found that smaller particles in that sneeze, so in, again, over here, this droplet nuclei, they can travel as a gas cloud. So up to 25 feet at a really fast speed, 33 to 100 feet per second. So you can't outrun it, and it lingers in the air for about 10 minutes. So think about maybe how odors spread from a barbecue if you're at your neighbor's, okay, and you can smell them. So kind of like that. So before we talk about how to prevent COVID-19, we really need to know how it's transmitted. Generally, and in the evidence really shows that it's mostly through close contact, person-to-person spread. That's primarily via those respiratory droplets, those larger droplets. So when someone's talking, coughing, sneezing, and that's 6 feet. As I mentioned, there's a lot of current evidence or new evidence discussing aerosol spread. So while this wouldn't be the primary driver in everyday settings, it's very important for healthcare because of the aerosol generating procedures that we do. There is some new evidence and new studies coming out. That's what this little graphic here talks about. This was published in the MMWR, so by the CDC in May. And it was following a 2.5-hour choir practice attended by 61 people, including 1 symptomatic index patient, that's the red one there. 32 were confirmed and 20 probable secondary cases occurred. So that's 87% of the group developed COVID after this one person. 3 of those patients were hospitalized and 2 actually did die. So this is some evidence of spread augmented by singing and really the evidence for the aerosolization. There's also some additional evidence coming out of a dining spread during, basically caused by air conditioning in a restaurant in China. It involved 3 family clusters, and it just found basically where they're sitting, and that's where the airflow from the air conditioning just flowed right over them, and they all contracted COVID. So more and more information is coming out. That one is early release and going to be published in the Emerging Infectious Disease Journal in July of 2020. So if you're interested and want to look that up. And then the third way of spread is really by touching a surface or an object that has the virus on it, and then touching your T-zone that we all hear about. So when is the best time, maybe, to transmit COVID? And really, the most efficient transmission is when the person's the most sickest, when they're really symptomatic. But again, like I said, this thing has been changing constantly. And new data, yet again, is suggesting that transmission by people is happening a lot when they aren't showing symptoms. So when they're asymptomatic, 35 to 40% of the cases. So silent transmission. So that it makes it really hard to prevent if you don't know that somebody's infectious. So mention surfaces, right? That's one of the methods for transmission. So what about that? In March, in the New England Journal of Medicine, a nice study was done showing how long this virus can live on surfaces. You can see in this chart here, 3 days is kind of the longest right here. And remember, this was done in a lab, a very controlled setting. So I guess take it a little bit with a grain of salt, because we don't really know how virulent the remaining virus is after that 3 hours or even within those 3 days. So how much is required to cause an infection? What's the infectious dose needed after something's been on stainless steel for 2 days? That third day, maybe it's not so much, but yeah, it is still there. Evidence does suggest actually that it is harder to catch the virus from soft surfaces, so fabric. It would be harder than, say, a hard surface like maybe an elevator button or door handles. Okay. So now that we know how it's transmitted, how do we prevent it? So prevention at home is really clean and disinfect. So those are two different things. Cleaning is getting the grime off. Disinfecting is killing everything. And you must clean before you disinfect. Okay, you can't disinfect through grime on stuff. Okay, so clean and disinfect frequently touched objects and surfaces. So what are those? Cabinet handles, doorknobs, light switches, faucets, sinks, toilets, phones are a big one. Lots of things we touch a lot. Use approved disinfectant. Again, what does that mean? If you go online, there's an EPA list. So go on the EPA website. There's a nice list that tells you exactly whether the disinfectant you're using is effective for coronavirus or for COVID. Okay. And then, of course, always follow the instructions on the container. That's really important. Read it. Each one is different. Some have a dwell, or what we call a contact time, meaning it has to stay wet to be effective for a minute. Some it's 3 minutes. Some could be up to 10 minutes. So really look at what you're using. And then frequency. Make sure you're doing this every day. Seems like a lot, and have a sparkly home. As far as laundry, use the warmest water setting and dry everything completely. The virus dies at 133 degrees. So if you dry everything, it should be good. Avoid touching your eyes, nose, and mouth with unwashed hands. So that's that T-zone that I mentioned before. And it's amazing to me. I've looked at some research, and they say we actually average touching our face 16 to 23 times every hour. So I don't know, maybe count your friend sitting next to you and see how many times they've touched. But it's amazing how much we do that. Then, of course, cover your mouth with your arm or your tissue if you're coughing or sneezing. That's what we hopefully have been doing for a long time. And frequent hand hygiene. My favorite, should be everybody's favorite. Definitely keep your hand sanitizer with you. Make sure it's readily accessible everywhere you go. It needs to be 60% alcohol. And that's for everywhere you're at. Then when you come home, wash with soap and water for 20 seconds right when you return home. So you're not bringing anything from outside in. So what about prevention in the public when I'm out in the public? Social distancing is the norm, right? And we've all heard this word. What does it really mean? So really, consider adjusting your group activities is really what that means nowadays. Smaller sizes. So I think we probably all saw it in the news, the pool party at the Ozarks. Maybe that wasn't a best choice. Maybe instead I don't know, get the kiddie pool out in the backyard with your grandkids, so smaller sizes. Limited time, do stuff outside instead of inside. The little balance there, that is because that's what this has become. It's really become a balance. We know the past couple months, we're all very aware of the closings that have happened, the toll that this virus has taken on our civic community, the economic toll. We've all missed individual and personal moments, you know, with our families, our friends, whether it's a birthday, a graduation, funerals, whatever. So basically, that balance means know your own risk and what your tolerance is for that risk. And it is a personal choice that we all need to make. But there are some things we can do to decrease that risk, right? So when you're out, maintain that 6-foot distance from others when you're able. So if you're standing in line, stand a little further back. A lot of places have the little X now. Stand on the X. Avoid close contact with people who are sick. And remember, some people without symptoms can spread this. And then the big one for everybody to help everybody is to stay home when you're sick. The other things you can do for prevention in public, consider use of a cloth face mask. Like Amber said, we are using face masks here at Mary Greeley. Masks help protect other people in case you're not infected, in case you are infected. So remember, it's that asymptomatic spread, but it is not a substitute for maintaining social distancing. Does the type of mask matter? So this graph over here on the right is really, it's a study from 2008, I believe, so even pre-COVID, and it basically is indicating that the surgical procedure mask and the N95 mask, they're better at preventing environmental contamination, but it does show that a homemade mask does some good. It captures about 60% of particles. So there is a good reason to wear one, protect the environment. The big question then comes is how does it protect me wearing it? And that is what really has not been proven for homemade masks. It's really variable based on the mask fit and the mask material for those homemade masks. So really, if you are wearing a homemade mask, make sure that you cover your mouth and nose and try to get some that fit a little more snugly, because that will help. The other thing is wash and dry them daily, and that's really because of the bacteria. You know, it's not so much, well, it's the virus too, because then you'd be touching it, and hand hygiene every time you take this off and on, don't forget, but wash and dry it too. And then, should we wear face shields? So this is kind of an interesting question. There's a picture of a guy there with a face shield and a mask on. Some of you might have seen the Des Moines Register article from May 27th, and it really talked about the University of Iowa researchers, and they recommended for the lay public that, that they wear a face shield, that everybody wear a face shield. Certainly it has its benefits, right? It's going to protect your eyes, and it's also going to protect us from touching our T-zone that we like to do. But it kind of comes down to practicality, and again, evidence. Is there a lot of evidence for that? So it's one of those things, maybe we'll see that come out. You know, like I said, things have been changing, so it might become a recommendation. Then you definitely need to monitor your own health, of course. Be alert for symptoms. The symptoms there are listed: fever, cough, shortness of breath. Then you've got the additional kind of flu-like stuff: chills, muscle pain, headache, sore throat, and new loss of taste or smell. That was a later symptom that the CDC added. If you do get any of these symptoms, of course, take your temperature and then notify your physician right away. Certainly, if it's an emergency, you'd want to, you know, go to the emergency room. Otherwise, if you're going to go to your physician, call or email before you go visit, so they have a chance to be prepared. And then we do get the question frequently about testing. Should I be tested? So certainly, if you're symptomatic, they're going to test you. Your physician will test you based on to diagnose if you have an acute infection. But you know, if you're not symptomatic and you want to help with gauging community spread, Test Iowa is there. This is through the Iowa Department of Public Health. I'm sure you've heard about it. There's no reason you can't sign up and go be tested. Register online. Currently, I believe last time I looked, there were 11 sites throughout Iowa, but I know the health department changes that based on usage every once in a while. The thing to remember if you go to Test Iowa is this does represent a single point in time when the sample was collected. So you could be exposed later and get sick. It doesn't mean that you won't ever get this disease. It just means right at this moment you don't have it, okay? The other test you might hear about in the news is the antibody or serology test. This one indicates that you had the virus in the past, but you're not currently infected. So in general, evidence really is not yet supporting the use of this to determine a person's individual immunity level or your immunity status. There's, like I said there's a lot of questions that remain. How much antibody is actually protective? How long does the protection last? Is it 3 months? Is it 6 months? Is reinfection possible? There's just a lot of unknowns about that. The antibody serology test is a blood test. The other one, the Test Iowa one, that one is collected more as, it could be a nasal swab. Typically, it's a nasal swab. They are coming out with some additional tests that are saliva tests, so you might see those as well. Again, more changes. And so what does the future hold? Wish we had a crystal ball, and we knew that. There is some good information coming out about vaccines, a lot of work going into this. More than 100 projects around the world focusing on development. As of May 11th, 8 were being tested in clinical trials actually on people. So when you're testing vaccines, you know, you go through many phases of testing. And when you get to people, after the animals and the safety studies, then so you know you're moving along on the right track and you've passed a couple of phases already. Per NIH, a large-scale testing could begin in July with a vaccine available by January. And actually, I did hear about a different vaccine that they were touting that maybe would be ready by October. You know, really hard to say, but really more realistic is summer of fall of 21 is when something that would be widely available, because then they have to mass produce it too. So. We get a lot of questions about, is there going to be a second wave of COVID? And I know we've heard here in the news a lot about, oh, this fall and COVID with influenza, it's going to be a bad season. We don't know. Gosh, I hope not. But if it happens, we're prepared at Mary Greeley, and we can handle it. Then the last question, is there going to be football in the fall? Again, we don't know. We hope so. Go Cyclones. That's what I would have to say. So, any questions? We'll see. I think Vicki's going to come down and help us out here.
Yeah. So you have to come in there now.
Okay.
All right, I'll just let you go with the questions.
Ooh, I might need some help with that.
Yeah, I'll come down with you.
Okay. So I see the first one on here is, how were our N95s disinfected? So we are doing a process. It's called a... we send them down to our sterilization department. They are not actually sterilized, though. They are through a vaporized hydrogen peroxide process is what we are using. And Betsy, if you want to call me, I know where you're from. We can talk about it further, but so we peel pack them, we put them in, we aerosolize them afterwards, and then, as Amber mentioned, we set them aside later. We do about 10 at one time per cycle, and each mask we've looked into can be disinfected up to 10 times. I hope I answered that a little bit for you.
And the next one I can take. So this one is, are there any additional preparedness plans in place for when schools reopen and ISU students return? How is Mary Greeley coordinating this with Iowa State Student Health? Really good question. So this goes back to those surge plans that were crazy on the screen. I'm sure you didn't get a look through it all, but we know this isn't a one and done type thing. This was, as emergency management goes, it's a really good exercise that we've gone through, and the surge plans we have created actually allows us to implement them whenever a surge would come into the community. So we are very, very well prepared for any type of a surge related to reopening things or students coming back into the community. We also meet with community leaders every single week. So we're meeting with the Ames PD, with the school districts, with Iowa State, the local leaders, and we're making sure that we're coordinating all of our efforts. And so we rely heavily on each other. And I know Iowa State, as it relates to student health, we're kind of in the same scenario. So we just met with them, and their biggest concern right now is the ability to test, or the lack thereof. And so Thielen Student Health Center has very, very limited capacity right now for testing. So we'll all be partners in this. If or when we get abundant supply of testing, goodness, we would love to help out the community as well. Time will tell. Yeah, so that question from Nancy is, what preparations are you making for the return of Iowa State students and football fans? So same deal. Is Mary Greeley using telehealth with patients? Absolutely, yes. So I can't remember if I put it on one of the actions taken, but telehealth, it's a interesting scenario where we've tried to get telehealth as a nation up and running for years. And 2 weeks into our COVID process here at Mary Greeley, we had outpatient clinics open. We're actually using telehealth on our inpatient units right now via baby monitors and iPhones. And so in these COVID units, we have baby monitors in the room. That way our staff can watch our patients and not have to always don PPE. So it saves on very valuable PPE as well. So telehealth is alive and well in the healthcare industry today. And I think that one's you, LeAnn, maybe?
Okay, could you discuss guidelines for older adults and or vulnerable to socially re-engage with others this summer? Yeah, so the guidelines are, I don't know that there are specific guidelines for older adults. Certainly you have to look at your risk. And there are guidelines, the CDC, the health department, about people who are at higher risk. And then again, it's kind of what I talked about with that balance. It's really something you might want to discuss with your physician and know, how vulnerable are you? Who are you engaging with? Is it a small group, a small family group that you know that they aren't out with several other people? It's a very individual decision. And then the next part, yes?
And it also says on there about outside. Is there anything different between being inside and outside? And repeat
Yep.
what I asked.
Yes, so Vicki just asked, there's a question, the next question actually, guidelines in terms of outside. Is there a difference between being inside and outside? Yes, there is definitely a difference. So any respiratory disease or, spread, if you're in a smaller room, that's going to, and for a longer amount of time, obviously, you then are going to be exposed more and potentially have a higher infectious dose. So outside is certainly better than inside. Larger rooms are better than smaller rooms, just like fewer number of people rather than larger numbers of people. So, yep. The recent attention given to COVID, we've heard very little about what's anticipated for this year's flu season. Have any information on what might be circulating when vaccinations might be available? So the vaccinations, as far as I know, will be available as normal. As far as what's circulating, yeah, that's kind of interesting. Usually we take our cue from Australia because they're a little bit ahead of us, so we look to them. And they have had a very mild flu season. Don't know if that's because underreporting because of COVID or if it's actually a truly, less severe season. We don't really know. It's still a little early to tell a bit of that, but the next one, if proper hand washing is enough to get rid of potential virus on hands, why isn't dish soap and water use enough to clean and disinfect kitchen counters, for example? Great question. Betsy, that's a very good question. So it's definitely enough to clean kitchen counters. So the big thing really with soap and water on your hands is you're washing it down the sink, so it's that friction. So yes, it would be enough to clean. It may not be enough to disinfect, but remember, anytime you're doing stuff with food, even if you use a disinfectant, you need to follow it up with water afterwards because you don't want to be ingesting that disinfectant. So I would say the disinfectant is kind of that extra level of protection, okay? And it's not really good to put that stuff on your hands. So is there any additional benefit to a cloth face mask if you insert an additional filter? Yeah, I've heard this one too. And there are some studies that would say yes and some that would say no. I don't think it would hurt. It's kind of one of those that, hey, I'm going to use more. Big thing is if you're using a face mask with other items. So, in healthcare, we would use it with a face shield, and then we wouldn't want it to interfere. And depending on your fit, that's the other thing. If you put something inside that mask, it can alter the fit of the mask. So it really depends on the mask. Finally, yes, there will be football, 50% season ticket holders only. I'd heard that too. Wonderful.
Nope. All right. All right. Well, if any other questions pop up, I will pass those along to Amber and LeAnn and get those out to you. So thank you so much for a very enlightening program, Amber and LeAnn. Like our science is out front, we're all in this together, and so we were hoping just to give you a little bit of information and also make you feel good about what we're doing here at the medical center. So, and yes, I will speak. Yes, they say we're going to have football this fall, but that it's early June. So a lot can change between now and then, but let's all wear our masks and use good hand hygiene and all that good stuff so that we can get back to all those fun activities that we want to do. So as of right now, since we've been in limbo with what's going on in the world and offering programs, for the unforeseen future, we will be doing virtual programs. I do not have any other ones scheduled right now, but please know that we are working on that as we speak, and I will get information out to you as soon as I have it. So thank you for joining us. Again, if you have any suggestions on how we can make this a better experience for you, please email and let me know. Until we see you again, stay safe and healthy, everyone. Thank you.